At Isolite Systems, we believe better isolation equals better dentistry. Better isolation means faster, safer, more comfortable procedures for you and your patients, less neck and back pain, and less chair time per patient so that you can grow your practice. At the heart of the Isolite system is the unique patented Isolite mouthpiece. The soft, flexible, non-impinging Isolite mouthpiece isolates upper and lower quadrants simultaneously, retracts and protects tongue and cheek, delivers bright, shadowless illumination throughout the oral cavity, continuously evacuates fluids and oral debris, and obturates the throat to prevent inadvertent aspiration of material. Easy to place and comfortable for the patient, the Isolite mouthpiece can be placed in only a few seconds and removed even more quickly. Economical, single-use mouthpieces mean no risk of patient cross-contamination. When you really think about standard four-hand dentistry, a number of challenges emerge. The tongue is in the way, hands are in the way, suction is in the way. Patients need to be repositioned for better access or visibility, overhead lights need to be adjusted, moisture builds up from the breath, and saliva continuously soaks cotton rolls, which need to be changed, adding time to each procedure. These challenges led Dr. Thomas Hirsch to rethink dental isolation and invent the Isolite Dryfield Illuminator, a technology breakthrough that delivers illumination, hands-free evacuation, and retraction all in one easy-to-use device. This paradigm shift in isolation, combined with an ergonomic design that reduces fatigue and repetitive stress associated with retraction, suctioning, or otherwise repositioning the patient, has resulted in several industry accolades since Isolite was launched. Dentists using Isolite are reducing procedure times by 20 to 30%, making the entire practice more productive and profitable.